In which year do you think that Germany is going to join the European health data space? It's, 2025 is just basically 2 years away.
2 years is nothing when it comes to infrastructure. I know that. We're going to do our best to be there and ready. So that's one of the reasons why we said that our health data law on national level is already going to be drafted next year and hopefully be implemented before the EHDS is there, to have Germany as much EHDS ready as possible. So partially we're already trying to implement the EHDS with that national law before the EHDS comes to the market officially. That's one of the reasons we try to be as fast as possible. Will the whole of Germany be EHDS ready? Most probably not. So I think one entity which I could see which we could easily link on a European level would be the Health Data Lab, which is a data repository of all the claims data which we collected over the last years from all persons who are in the statutory health insurance system. So it's 73 million people that data would be accessible. I could also see good options to have the cancer risk registries linked to the EHDS, and other entities as well as university clinics with the network of university clinics. So I think there are a few entities which could be linked as a first step, but I think having all the healthcare providers attached to it and their data directly accessible, that's not going to be possible in a short term. So I think there are also step by step.
We mentioned earlier that a lot has already been done in terms of having a very specific idea regarding how the European health data space is supposed to look like. So a lot of questions have been answered, at least to a degree. Is there anything that you see is still kind of the big open question in regards to this topic?
Well, I think one of the biggest open questions when I look at the debates are going to be the timelines. I think the timelines in the regulation are not realistic for all member states at the moment. And I think that's something which we still need to debate to have them as realistic as possible.